So, welcome to the Recovery Therapist. Today's episode, we're going to talk a little bit about diagnosis and how I go about doing that. 25 years of working as a clinical social worker. I've got a certain checklist that I look at, and that helps me kind of determine how severe the disorder is and kind of what level of care may need to accompany that diagnosis. But before we get started, a little quick disclaimer. You should not consider this as me providing any kind of diagnosis for you, but this is for educational purposes. If these sound familiar, I would certainly encourage you to seek some licensed professionals to conduct a full biopsychosocial assessment to determine if you do in fact have a substance use disorder. So let's start at the very beginning. There's a manual that I use in order to make a diagnosis. It's called the Diagnostic and Statistical Manual for Mental Disorders, or the DSM. Within a substance use disorder, there are 11 criteria, and depending on how many of those hit, kind of tells me where you fall within that continuum. Essentially, with those 11 criteria, they fall into 4 categories. So the first is going to be impaired control. The second is going to be social impairment. The third is going to be risky use. And the fourth is going to be pharmacological. What we'll do is we'll call this the criteria scoreboard, and as we walk through this, I'll give you some examples from my own personal experience, both clinically and as someone in recovery. And at the end of it, we'll kind of tally up my criteria and figure out where I fall within the DSM at this point. In determining the severity, basically what I do is I look at those 11 criteria, and however many of those you have will kind of tell me where you fall. It used to be alcohol abuse or substance abuse and substance dependency. We've moved away from that, and now we're more on a continuum. So I've got a substance use disorder, mild, moderate, and severe. And same thing with an alcohol use disorder, mild, moderate, or severe. And based on how many criteria you hit, kind of tells me where you fall within that. So if you've got 2 or 3 of these criteria, typically that's going to put you on the mild end of that spectrum. If you've got 4 or 5, that's going to put you at the moderate, and 6 or more will move you into that severe category. That helps me understand kind of as we work through what level of care do you need, depending on how severe the disorder is, kind of gives me some guidance on what's the best plan of action as we move forward. Let's talk a little bit about the first category, and that's impaired control. Is that I'm taking a substance in larger amounts or over a longer period than intended. For me, I think as I think through this, not every time I drank did I lose control, but there were times where I did drink and I did lose control. I would say, hey, I'm just going to have a couple, and I end up having 5, 6, 7, 8, whatever that is. That's the loss of control. So I was going to just have this many, but I ended up having more. As far as for a longer period than intended, I think the example for me is there were times where I would go to a happy hour, and my intent was just to have a drink or two and then go back to the house. Instead, I would end up drinking all night. Before I knew it, the lights were coming up and it was last call. I was like, what am I doing here? This was not my intention. The second criteria is a persistent desire or unsuccessful effort to cut down or control use. And this is where we start to see some of our control strategies come into play. For me, there was a point where, I was just going to drink on the weekends. I was only going to drink beer. For some people, they start to put in these complex strategies to help them kind of manage their drinking. And if you're having to do that in order to limit your alcohol use, clearly there's some sort of issue that's beginning to occur. Not every time I drank did I get in trouble, but every time I got in trouble, I seemed to be drinking. That was kind of the thing that started to hit home for me as I started looking at my drinking. And again, my inability to control or cut back really started to play a role in some of that stuff. I think for some, including myself, this was always the great white whale. I always wanted to go back to that controlled drinking. I didn't want to have to get to the point where, I was drinking more than I intended. I just wanted to be able to have a couple and relax and not get to that other place where I was a sloppy drunk and the consequences were starting to occur. But what I've known through my own experience and also working with others, that this is part of the progression of the disease. And so as I moved down that train track, that ability to kind of go back really is no longer there. I remember at one point in my drinking career, I'd stopped for 30 days, hoping that would reset everything, and it didn't. Basically, within a week or two, I was back drinking to my levels that I had drank, and if not more than when I had stopped for those 30 days. The next criteria is going to be spending a lot of time obtaining, using, or recovering from the substance. When we look at that obtaining thing, I think for someone who's using illicit drugs, this is one of those things where I'm having to kind of strategize, how am I going to go get my substance? A lot of times they're in a little bit shady neighborhoods, and so I kind of have to plan that out. I certainly may not want to be there at night, and it may be across town. It's not necessarily easy, like just going to the liquor store or the gas station to get alcohol. I think for alcohol, thinking about time obtaining also is, how do I strategize? Because I need to go get alcohol, but my wife is gonna know, so I need to be careful. I need to tell her I've got to go do this instead. And so I'm coming up with doing all these mental gymnastics, trying to figure out how can I rationalize that sounds legitimate so I don't get in trouble and my wife doesn't say, hey, what are you doing? And confront that goal of the addiction, which is to continue to use. Obviously using, for me, it got to the point where alcohol really became kind of the babysitter or the time machine. And what I mean by that is I would come home from work, I would start drinking, and that would be my night. And I would just drink until I was ready for bed, and then I would pass out and then come to the next morning. And that was my time machine. I would come home, lose time, wake up the next day, and then I was ready to go. Obviously, my rebound ability, as I got older, became less and less, became more difficult. The hangovers were pretty paramount. I was able to kind of muscle through most of those in my 20s. I noticed towards my end of my drinking, it became a little more difficult. That whole recovery process just took time, and it took longer into the day for me to kind of circle back around and get better, and to get better. So this last one is cravings, or strong desire or urge to use a substance. I think for me, the example that comes to mind is I would wake up the next day after a hard night of drinking and tell myself, I'm not going to drink today. And that would be my mantra. I would start the morning with, I'm not going to drink today. And it would go through the morning. I'm not going to drink today. I'd be at work. I'm not going to drink today. I'm not going to drink today. And by noon, I would still be there. I'm not going to drink today. I'm not going to drink today. But my craving and that urge had started to creep in and started to kind of hit. But I would fight it off, and I would say, no, I'm not going to drink today. I'm not going to drink today. And then around 3 or 4, I would tell myself, well, I think I can have just one. And it was never just one, right? If I had that one, it basically was going to throw me up to the first and second criteria that we started with. That it was going to be that loss of control, and I was going to be on a run. There's an adage that says, one's too many and 1,000's not enough. And that's kind of where I was at with my drinking. Once I flipped that switch, I didn't know when it was going to end. The next category is social impairment. And the first criteria is a failure to fulfill major roles or obligations at school, work, or home due to your substance use. And as I shared with you during that first video that I did, I fabulously flamed out at college my first time through. And that was all because of the alcohol use. I guised it as it was a party, and that, this was just part of what you did in college. But it became the point where I would just rather drink than go to class or to study. I think for work was always something that I tried to make sure that I at least went to work and was there so I could collect the paycheck. Because without the paycheck, I couldn't buy the alcohol. So it was always important that I had that money in order to continue to use. For home, basically, I just wasn't reliable. I know that my parents growing up would be counting on me to do things, and a lot of times I would just be drunk or hungover the next day, and I just couldn't meet those obligations. Next criteria is continued use despite persistent or reoccurrent social or interpersonal problems caused or worsened by use. And what this one is I'm having these issues that are persistent and they're reoccurring over and over and over again, with friends and family and loved ones. And it was caused or got worse by my alcohol use. When I think about those relationships that I was in, alcohol was always a primary. It always kind of took precedence over the other things that we were going to do as a couple. If we couldn't drink alcohol, chances are maybe wasn't going to go do it. That put a real damper on my ability to significantly couple with somebody and be emotionally attached. And as far as like social friends and those kinds of things, I just wasn't reliable. They couldn't count on me. The last criteria in this category is giving up or reducing important social, occupational, or recreational activities because of substance use. And what this one is about is I stopped doing the things that I like to do because I'd rather drink. I start kind of doing things that I can do while I am drinking. For some people I've worked with, they stopped woodworking because obviously drinking and being around power tools is not a good thing. They gravitate towards fishing, or they gravitate towards shooting pool or bowling or playing darts, because those things I can do and I can drink. I just kind of truly lacked discipline at that point. I know that when I was in my relapse phase, I would meet with my sponsor on a regular basis during that period where I was trying to stay sober. And that idea of relapse would kind of click in there. And much like we had talked about earlier with that voice that started when I was trying to convince myself not going to drink that day, this one would start a couple, 3 days before that, this idea that I could maybe drink. And I would fight it off a little bit, and I would go to my sponsor, and I would never tell them that was going on, because if I told them, they may tell me something that would prevent me from drinking, or maybe tell me something that was, hey, this is a good idea why you wouldn't want to drink. And so I never was honest with them. And that just made it really difficult for, the social part of it. So for me, I think this one, I had lost several jobs. I know that I said in that first one that work had become important because it provided me money to be able to buy alcohol. But I ended up losing some jobs because I was only probably putting in 40 or 50 or maybe 60% at the greatest of what I was actually capable of, because I was hungover most of the time. And there really wasn't much room for growth when I'm just trying to survive. As far as that social or recreational activity, again, I gave up those things that I couldn't do if alcohol wasn't involved. If it was a choice of doing something that, if I was out with friends or going on a date, if we couldn't drink, then I probably wasn't going to be too interested in doing it. I know when I was in that relapse period, I struggled with being honest with my people that were in my support network, because if I told them what was really kind of going on, they would tell me something that maybe would convince me not to drink, and I didn't want to have that possibility. Alcohol was still kind of there, and it was still pretty ham-fisted with me, and just wasn't going to let me go that easy. And so I had developed these strategies where I just wouldn't be honest, and then that way I could kind of slip out if I needed to. And that's kind of what created that relapse cycle, is I just couldn't be honest. Next category is going to be risky use. And the first criteria is recurrent substance use in situations where it's physically hazardous. So these are drinking in situations that could be dangerous, essentially. For me, I kind of go back to, there were times when I drank and drove. Obviously not proud of it now, but at the time, the first thing that goes when you start drinking is judgment. And so this idea that, hey, I can still drive, I'm still fine, was already lost because of the impairment that alcohol had already kind of set in. Thankfully, I didn't hurt anybody other than myself. I had some single car accidents. I think about walking around with one eye covered because I was, I had double vision from my alcohol. That's dangerous. I'm sure that there have been times where I've had slips, trips, or falls because of my alcohol use. In my practice, I've worked with people that had some head trauma from falls while they were drinking. Obviously, bar fights, those kinds of things, physically hazardous while we're drinking alcohol. Again, a lot of times when I was drinking and putting myself in dangerous situations, it wasn't that I wasn't intelligent to recognize it for what it was, but alcohol just seemed to override all common sense. And again, it was about drinking, not necessarily about being safe at that point in time. So this next category is continued use despite the knowledge of having a persistent or recurrent physical or psychological problem that could have been caused or exacerbated by substance. And basically what this one is it's just saying that I knew I had some sort of psychological issue or a physical issue that was caused or could get worse from alcohol or drug use, and I continued to do it regardless. I think throughout this whole kind of process, when I was drinking, I got to the point where I knew I shouldn't be drinking, but that wasn't enough to stop me. I remember in my early 20s, I went to the doctor and we did some blood work on a regular physical, and he came back and said that I had some elevated liver enzymes and told me that, normally this is kind of something that we would see with somebody who drinks too much. But if I'm not drinking too much, then just keep an eye on it. And of course, I went with the I'm not drinking too much in my own head and just went with that. The reality was that it was clearly my alcohol use that had increased those liver enzymes, and I'm pretty clear about that today. I also remember at one point I had some severe stomach issues, and this happened to me a couple of times, and I would try to rationalize that stuff away and not give it any kind of credence that it was alcohol. I know at one point I worked with a guy who was in med school, and I asked him if toothpaste could create my stomach issues, and he was like, yeah, no, I don't think that's what it is. Again, I wasn't willing to acknowledge my alcohol at that point in time. Another time I remember I had stomach issues, and again, I thought that maybe it was just some sort of beer issue and not necessarily the alcohol that was in the beer, but the beer process itself. And so I switched over to wine coolers because it was the only thing that I could kind of tolerate and still continue to drink. I remember at one point working with somebody who had esophageal varices, and what that is, it's you drink so much that eventually your esophagus thins out and it can rupture, and they come back in and they staple it closed, and basically you get kind of one bite of the apple with that. If you go back to drinking, it's really kind of terminal. Unfortunately, I did see him about 10 months later, and they had relapsed. So that obviously wasn't enough to kind of kick him into some long-term recovery. But that, again, is an example of, we knew that alcohol had physically damaged his esophagus, and that still was not enough to keep somebody sober. So obviously they would have met the criteria for this. So the last category is pharmacology. And the first one is tolerance, a need for a markedly increased amount of a substance to achieve the desired effect, or markedly diminished effect with the continued use of the same amount. Basically what they're saying with this is, I need more to get to that point of feeling impaired. And then at some point it reverses, and that I feel more impaired with that amount that I'd become accustomed to. For me, I think back, at one point I was minimally drinking a 12-pack of beer a night, and I was drinking it fast enough that I could go buy it, put it in the freezer, and drink it before the last beer froze. I remember that when I would get to my 7th beer, it would be the saddest beer because I knew in my head that I was halfway through my 12-pack. And so, to me, that tolerance eventually had built up, and I almost used it as a badge of honor that I could drink more than most people and not show the effects of alcohol. And that's kind of that other piece of tolerance, is the body starts to kind of make some adjustments, and they may not seem as impaired as somebody who is at that same blood alcohol concentration level, because they've built that tolerance. I think I had built a pretty substantial tolerance and had been able to kind of somewhat function, not really optimally in reality, but in my own head, I thought, yeah, I'm still able to kind of manage. The second criteria is going to be withdrawal. The characteristic withdrawal syndrome for the substance or taking the substance to relieve or avoid withdrawal symptoms. What withdrawal is when I quit taking a substance, I start to have physical kind of effects. And in order to relieve that, I start to use the substance again. There were times where I would try to go cold turkey when I was in that relapse place. And a couple days into it, I would just be vibrating because my body was wanting alcohol. And generally, if I went back and drank on it, again, that would become that kind of that negative reinforcement. So I know when I got into residential, part of that procedure was they were monitoring my blood pressure, and it had escalated to the point where they thought it could be problematic. So I went through a medical detox, which again, we want to make sure that people are safe. Really, the withdrawal is going to be the opposite of whatever that effect is. So with alcohol, it suppresses the central nervous system. The opposite of that's going to be agitating the central nervous system. So again, we got kind of some shakes, tremors, irritability, those kinds of things. When we look at stimulants, cocaine, methamphetamine, generally those are stimulating in uppers, and so that the withdrawal from that's going to be the opposite. So we're going to see some crashing, some sleeping. So as you can see, I scored 11 out of 11. So that puts me in the severe category. So obviously it was important that I ended up going into residential because that was the level of care that I needed at that point in time. So if someone came into my office and they had this score, I would certainly encourage them to get into some sort of residential program, give them some of that breathing space that I needed just to be away from alcohol, not to have access to it, and also give myself a little bit of a leg up in that recovery process without me sitting around thinking about how can I get the alcohol. So if you recognize yourself in two of these, kind of take note, two or more. You may want to take note. You may want to get with a professional so they can give you an official diagnosis. I think the important thing to understand is if it's a diagnosis, again, we're not talking about moral failings or lack of willpower. We're really talking about the disease model of addiction. And if we're diagnosed, then that means we can develop a treatment plan around it. We can see if we can't help engage and work through. And I think that's the important thing as we think through this. Why is it important to understand what these criteria are? Because if I know that I have them, then that gives me something to target as I start to get into that recovery space. Example, maybe I have cravings for alcohol. One of the things that we know that helps cravings is medication-assisted treatment, naltrexone, substance that typically reduces the cravings and can reduce them significantly. If I have withdrawals, based on my history, if I know that when I've stopped drinking in the past or stopped using in the past, I have withdrawals, I probably need to get some sort of medical attention to help me with that. When we look at an opioid use disorder, generally the withdrawals of that is just miserable. It is incredibly difficult to get through. So when I think about 10 days, and generally that's what it is, it's 10 days of a bad case of the flu, getting help to help me get through that, to be as comfortable as I can, instead of going back to alleviate those symptoms by using, obviously becomes important. I think the last thing I would say is that category when we look at impaired control. When I think about control, if I've had a loss of control, if I have times where I mean to only drink so much and I end up drinking more, that's significant. We need to understand that. Generally, when we look at somebody that has that loss of control, I'm probably looking at abstinence, because the only way I can guarantee not losing control is if I'm not using. And I know that's harsh because a lot of people want to try to do that risk reduction or, drink in a social setting or, moderate my drinking. And again, if I've lost that control piece, just really isn't going to happen. And that's my own personal experience, but that's also kind of the experience working with people that I have seen. You have to make some decisions. I had a guy that I worked with who told me that, he learns two ways, through education and through blunt force trauma. And so for him, he just had to go to the school of hard knocks sometimes to learn how to get sober. So when we look at this, it's really just about education, educating ourselves, beginning to understand what is this disease, what is it about, and how do I defend myself against it, because it's there And that voice that's there that wants you to use, it gets loud. And we got to figure out ways to strategize around quieting that voice and eventually getting to the place where we just don't even listen to that voice. It still stays around. Mine's still there sometimes, but I've learned to really kind of tune it out. I think the drink through, get to the other side of it. Yeah, I could drink, but what's really going to happen at the end of this whole process? We'll talk a little bit more about that when we start looking at coping strategies and those kinds of things. So in the next recording, we'll move on from diagnosis and we'll talk a little bit more about early recovery and what does that mean. So we'll probably get into managing withdrawal and developing early coping strategies and some of that, maybe the first week of recovery, what's going to be important to know and recognize. So I appreciate you guys being here. If you like the video, obviously hit that thumbs up thing. And if you want to ask me any questions, feel free to drop them in the chat there. Let me know where you're kind of at. Appreciate you guys hanging out with me, and you guys have an awesome day. Be safe.